Hi, I hope everybody's having a great time. I know I am. I usually love this event just because of the diversity that's here. You see a lot of, every shape and form in the US and the world here. AR and MR, they can really bring us together as humans. And that's, one of the things that really kind of motivated my whole experience with healthcare. I lost a grandpa to Parkinson's, and nobody told us about hospice and kind of basic things in healthcare that you need to know. So a little bit of my background real briefly. I worked as a nurse's aide for several years going through my RN training, and then I worked on the floor, mostly locked dementia units, ICU, ER, telemetry units, those kind of places. So places where that last mile is super important, and it is that bedside care that needs to be documented, and that's where a lot of the errors are occurring. So focus in healthcare, in my view, going forward with MR, AR. I don't see a huge role for VR in healthcare, but the focus is definitely on process improvement, improving the quality of care delivery and consumption. So how can this environment benefit not only providers, but also the consumers in healthcare? I just wanted to take my time today to highlight some cases. This must be a clicker? Okay. So workflows are super important, right? As a nurse on the floor, it wasn't uncommon for me to have 6 to 8 patients. These patients all had multiple medications, sometimes up to 15 different meds. Now, we're all driven off of task lists in the medical world. Current EMR infrastructure is all kind of time-oriented and driven by med orders, lab orders, procedure orders. So in a clinical environment where you're working on the floor, you have such constraints in your time that it's really hard to always get to that patient and pass out the pain med. If you've got to do bedside medication validations, scanning with a wearable is much easier than hauling what they call a workstation on wheel or a WOW around with you that has a computer station on the bottom, monitor on top, and then a wand that you scan with. So how do you really integrate this into saving time? With wearables, there's really kind of a force multiplier in play here. This is something that can make one nurse or one tech or one doctor turn into more like 5 people, right? So I don't know how many people have been in a hospital environment and waited for meds, but it's probably quite a few of us, right? And it's not a good experience. So how can we make that process a little bit more, user-friendly and frictionless? So some current use cases with VR and actual clinical applications include U.S. military. They like to do PTSD training, so desensitization. So soldiers that are brought into urban combat zones that have traumatic experiences, which I'm sure we can all kind of imagine there must be a plethora of them there. So they like to expose them to virtual reality environments of those same kind of settings to help desensitize the soldiers to those stressful and traumatic events to help them cope with the situations they're dealing with on a day-to-day basis a little more effectively. Surgical areas, they're starting to use VR to help train surgeons. This is probably the most applicable VR use case in my view of these emerging technologies in healthcare. So process improvement comes into play here is what's really happening. So if you can teach a surgeon in a VR environment how to perform a surgery correctly in, say, 4 hours versus pulling out a cadaver and having a surgeon come into a cadaver lab to practice a surgery on a real body, but that's already been dissected and manipulated, so it's not like it's going in and making the first incision. It's a completely different experience. So if you can give a realism to the whole experience, you've elevated the quality of your training quite a bit. And I've got links at the end of my slides here that I'll post them online later, but you're welcome to follow up. This is all published, studied information on actual studies that have been performed in ORs and other learning environments with AR, VR, and MR. I just wanted to point out one thing with the VR and training. There was a study done out of Yale and Queen's University, and this was back in 2002 to just give some perspective about how long this space has been kind of developing. They found that residents that were trained in a VR environment trained 29% faster, and there was no statistical difference in error rates between the two groups, traditional versus VR trained. So some pretty significant gains as far as time savings. Some other use cases with AR. AR is a real good use case for wearables such as head-mounted displays. I got into head-mounted displays back in 2013 with Google Glass and have been working with it since then. Some of the first things that head-mounted displays became popular for was video streaming. You know, it's very easy to stream video from something that you don't have to hold on to, but it looks everywhere you do. So it was a really compelling use case. Some later things that came along, as we see here on the left, is kind of artificial overlays on real anatomical structures to help with education and or surgical training. I personally think AR has got one of the largest use cases for healthcare going forward, along with MR. I think we'll see some pretty stratospheric growth in the next 5 years in that space specifically, just because of quality of education. And I think Ivana's a great track with the IV training. So first sticks, oh my gosh, does not happen a lot, and who wants to be poked over and over just to see if you can get an IV going and get some fluids running. So a really compelling use case for head-mounted displays, I believe, in healthcare. So the mixed reality environments are just starting to come out in the healthcare space. Some of the first use cases, unfortunately, in my view, are being used for sales. So Stryker is a medical company. They're using HoloLens to help sell their products, such as hospital beds, IV poles, and those kind of things. Other more applicable and I think kind of society rewarding endeavors with MR is different kind of training options. I foresee MR being a much more widely used surgical implement as opposed to just a training environment. VR I think is good for training. MR is super good for those environments where you're actually going to be interacting with a patient and creating and pulling data in real time from the EMR. You can do overlays on surgical structures. So if you're doing, resection on pancreas or something, very applicable in the surgical theater for a surgeon to be wearing that and getting real-time direction on where structures are. Okay, I have a few more slides, and then, if you want to take a few minutes for questions, I'm happy. And like they said, afterwards offline, always a great time. I did want to highlight a VR study with Cedars-Sinai. Cedars-Sinai has done some really innovative work here. So they did this study with a wide range of patients as far as socioeconomic factors and then also gender and race all coming into play. One thing that I did not think VR could ever be used for was diagnostic care. And they actually found in this study that one of the patients that they assessed had a nonspecific generalized complaint of abdominal pain that was nonspecific. So they couldn't figure out what was going on. They thought it was psychosomatic. They put him in the VR environment, and the patient did not respond to the VR therapy. So in a VR environment, the thought is that you get a disassociation from the pain. You're kind of rescaping your reality. They found it didn't work with this patient, so that led them to hunt down more rare conditions, and they actually came up with a positive diagnosis for an extremely rare condition with this woman. And so can you imagine being labeled? I mean, just think about this in our mind, right? I mean, mental health factors, and you're a patient going to see a doctor. These things are tagged in your chart. You know something's wrong with you, but you're not quite sure what, and the doctors are like, oh, I think it's in your head. Now, if we have these new emerging technologies that can help us eliminate things that in the past were not an object to be eliminated from our medical chart or history, it was just a question mark, we can now definitively say in some cases that these therapies are effective for treatments that, just wasn't thought of 5 years ago. You've got to be able to implement these in real time, and Cedars-Sinai has been able to do that with their care. And this is an ongoing project with Cedars-Sinai. They haven't just done this one time and left it. So psychosomatic pain use case scenarios for diagnostic care with VR, I think, is going to be pretty phenomenal as well going in the future. This is another application, and I'm sorry to the presenter, a couple before me, I did not know that his project was focused on voice and being presented. But this is another use case for wearables and a blind person interacting with their environment. This uses sound to scan the environment and creates a visual map that, based on frequency, directs the user over time as they learn, kind of like reading Braille, which sounds are indicative of objects in their environment, and therefore helping them navigate their environment. So MR is also really good just in general on the floor. So I see use cases coming in not too distant future where a surgeon or a provider comes in, they're following up with you after your surgery, or you've been admitted for a possible stroke, and you wear a headset as well. And now you have an interactive learning session with your provider that helps you really get a grasp of what your health condition is and what it means to have that health condition on a physiological level. As I said here, that's linked in slide notes for specific, like British Medical Journal has most of my links. You can find specific use cases for these objects if you want to follow up offline. I think that if you click through, you really see the applicability in healthcare is kind of uncharted at this point. It's an open space. We've barely tapped any of the potential that's there. So I'll post these online, follow-up links, and thanks so much.